leader. This is WCIA 3 News at 6:30.
We've simply drawn a line in the sand and say, hey, look, we can't put ourselves in a position where it would jeopardize our ability to provide care to our communities in the future.
A year after the largest health insurer in the state kicks Springfield Clinic's 650 providers out of its network, the clinic is launching its own health plan. Blue Cross Blue Shield broke up a 30-year relationship between the go-to network of capital city specialists over a requested rate increase for doctors. Our Target 3 team revealed that breakup left at least 55,000 patients without essential health care or with staggering bills. Our investigative reporter Renee Cooper is with us now. And Renee, are the stalled negotiations behind the clinic's plan launch?
Yeah, Jennifer, that's been the question. A vice president says the Springfield Clinic Advantage plan has been on the table for a long time and likely would have eventually happened with or without a continued relationship with Blue Cross. He says they couldn't have rolled it out any sooner, but the urgency of tens of thousands of patients losing their doctors kept the clinic from waiting any longer.
The number of calls that we've received from patients and employers over the past year just helped us realize that this is something that we need to do now.
After 80 years in business, Springfield Clinic is launching a first ever health insurance plan.
Ideally, we would have a agreement with Blue Cross Blue Shield. That being said, we've sent multiple proposals in the past several months with varying degrees of compromises, all of which have been declined with no counter proposal. And so I think the reality right now is that we're out of network with Blue Cross Blue Shield, and I think that that's our reality for the foreseeable future.
Vice President Zach Kirker says it's about more than potentially patching that gap in the new year.
This isn't about one insurer. The disparity between the healthcare organizations who are trying to provide the care and the insurance companies are growing. I really feel like our dispute that we're in right now is just the tip of the spear of what people are going to experience over the long haul.
Springfield Clinic isn't the only large local health network to launch a plan. Carle Health created its own with Health Alliance and since has cut ties with any other Medicare Advantage plans.
On that vein, does Springfield Clinic have any plans to stop contracting with any of the existing plans you have?
No, I mean, our goal is to be in network with all of those insurers.
Now, this plan Springfield Clinic has was created in partnership with Decatur-based Consociate Health. It's available to employers with 10 or more workers, so small businesses. The vice president tells me any doctors and facilities in network with HealthLink currently are in that Springfield Advantage network, including all Springfield and most other Central Illinois hospitals. To take a look at that plan and the doctor options for yourself, head on over to our website, WCIA.com. Back to you.
All right, Renee, thank you.